I'm Mary Byers, and this is Associations Today. My guest is David Owsiany, Executive Director of the Ohio Dental Association and Chair of the Ohio Healthcare Provider Coalition. I've been interested for some time in how associations are forming strategic alliances to be more influential, to increase their reach, and to further their funding for some of their initiatives. And David is joining me today to talk a little bit about how his association is capitalizing on a strategic alliance. Welcome, David.
Hi, Mary. Good to be with you.
Tell us a little bit about the Ohio Healthcare Provider Coalition, how it came to be, and how it got to where it is today.
Well, a little more than 10 years ago, there were a number of policy issues that were impacting on healthcare providers, and the Dental Association, the Medical Association, the Osteopathic Association were all working on these issues sort of independently, and it dawned on us that for many of these issues, there was an alignment of interests, and it might make sense for us to form a coalition to leverage our associations and our members together. And so the Ohio Dental Association, the Ohio State Medical Association, the Ohio Osteopathic Association, the Optometric Association, Ohio State Podiatric Medical Association, the Pharmacist Association, the Psychological Association, the Chiropractic Association, we all formed a loose coalition. We branded it the Ohio Healthcare Provider Coalition, and in a moment of weakness, they elected me as their chair. And we've been in existence now, like I said, for a little over 10 years, and it is largely focused on policy issues that impact on healthcare providers. And between all of our organizations, we represent more than 50,000 healthcare providers in the state of Ohio. So we get people's attention when we act as a coalition together, more so than if we acted individually.
Tell us a little bit about how often you meet and how the group runs, because that's quite a few. That's really a who's who in medicine in Ohio. So tell us a little bit about how you run the coalition.
The coalition is pretty loosely organized. We meet on a monthly basis when the General Assembly's in session and there's a lot of issues going on. If the Ohio General Assembly's not in session and maybe there's not as many policy issues going on, sometimes during the summer, we'll meet a little less frequently than that. I think the idea is to share information. We may all have individual initiatives, and sometimes it makes sense to say, I'm aware that another association, even if it doesn't impact on my guys or my members, be aware that another piece of legislation is being considered that impacts healthcare delivery. And oftentimes we'll find out that somebody's considering a policy matter that our association was considering as well. And so we can utilize the coalition to kind of join forces. But again, we meet monthly, and we all check our egos at the door, and we realize that we put everything on the table, but not everything is going to be a provider coalition issue. Some people choose to pursue pieces of legislation or regulatory reform that maybe doesn't line up with the rest of our associations. And that's okay, too. Not every issue is going to be a healthcare provider coalition, but we welcome anyone to bring any issue to the table.
So give us an example of how you've been able to coalesce around an issue that serves the majority of the members. And when agreement doesn't occur, do you just agree to disagree?
So a couple of examples where really all of our interests coincided. Recently, the General Assembly and the Ohio State Pharmacy Board were considering guidelines for prescribing opioids. And we all have an interest in ensuring that we limit the people who are doctor shopping, eliminate pill mills that may exist in certain areas of the state. None of our organizations wanted to stand in the way of those reforms. So we wanted to get on board and help develop policies that make sense with regard to prescribing authority. At the same time, we didn't want to eliminate the ability of patients who truly need access to these medications to have them. And so the coalition acted almost in unanimous fashion to work with the Pharmacy Board and the members of the General Assembly and leaders on this issue to make sure that the guidelines that were being drafted and put forth made sense from a prescriber's perspective, as well as protecting the public from opioid abuse, and the outcome has been tremendous. We've already begun to see a reduction in opioid abuse in Ohio. I think the policymakers get the credit for this, taking this issue head on. But I'm also proud that the healthcare providers were also proactive on this issue to make sure that patients were being protected. Other issues that we've worked on is malpractice reform. There was a situation probably about 10 years ago where the litigation situation in Ohio was very tilted toward the trial lawyers. And there were healthcare providers, especially in high-risk specialties, who were leaving the state of Ohio because their malpractice premiums were really out of the roof, above most other states, through the roof. And so we got together to try to put together some reasonable reforms so that healthcare providers would be protected from lawsuit abuse, while truly injured patients have the opportunity to pursue a remedy. And we found reasonable ground there as well to protect the interest of injured patients while at the same time protecting healthcare providers from abuse. And then there's always been issues related to the Ohio's Medicaid program. We have a very solid Medicaid program, but over time, reimbursements have been needed to be adjusted, or the policies with regard to administration of Ohio's Medicaid program needed improvement. And again, the Healthcare Provider Coalition was able to get together, work with our Department of Medicaid, and work with policymakers to ensure that people continue to have access to Medicaid services. And so the Healthcare Provider Coalition has had a long list of successes in working on policy issues. But I have to tell you, Mary, where we and my advice to anyone trying to put a strategic alliance together is make sure you've laid out the ground rules up front. And our primary ground rule was, we know that there are issues with which the Ohio Healthcare Provider Coalition members may disagree. You know, when you have this many disciplines represented, there will be occasions where there are issues that are really important to some segment, but not another segment. Or in fact, they may be on opposite sides of a particular issue. We made clear at the outfront that if there is not consensus for the provider coalition to act, we won't. So if one of our members said, you know, we're opposed to that issue, we will not take that on as a coalition. And we've stuck to those ground rules. And sometimes that means a majority of our members want to do something on a particular issue, and they can pursue it individually. But as a coalition, we won't do it on behalf of the coalition because one or more of our members have concerns about that particular issue. It's important to lay those ground rules up front, though. You don't want to get into a situation where you're several years into a coalition or several months into a coalition, and an issue comes up that splits the coalition, and you don't have those ground rules set out in advance.
That's great advice, and that's one of the recommendations I make to clients looking at developing strategic alliances is know not only how you're going to get into the alliance, know what the ground rules are, but also how you're going to get out of the alliance when it's time, if it becomes clear that things aren't working or there are no longer issues in common, to know how you're going to start, but also how you're going to finish. David, let's wrap up with a question about funding. How is the coalition funded? Is it a formal method? Is it based on the number of members that you have? Is it based on issue by issue? Or how do you handle that piece of the alliance?
Interestingly, there's not a whole lot of expenses related to the coalition. We meet monthly, we share information, we've sort of produced our letterhead in-house, so when we produce a document to send to the members of the General Assembly or other policymakers, we can really generate that electronically for little or no cost. Occasionally, we will sponsor events, and when we have events, that's where we have costs, and we tend to share the cost equally, although on occasion, because some of our organizations are a little bit larger than others, we work out sort of a pro rata share for the costs related to those events. But other than the event costs, there really aren't a significant number of costs related to the association, and I think that probably has been a elimination of a barrier, because there are members of our coalition who probably can't afford as much as other of our members. But since we've kept the cost down uniformly across the board for all members, we usually have every member of our coalition represented at every meeting. Sometimes it's the executive director of the association, other times it's the government affairs person. But it's sort of become the meeting that you have to come to every month in order to make sure you're up to date on what's going on in healthcare in the state of Ohio.
Great. David, thank you so much for sharing your experience. I'd like to thank my producer, ComPartners. If you're looking for an online learning partner, I suggest you contact them at compartners.com. This is Mary Byers with Associations Today.